Let's have a look at what he talked about. The prospect of a second wave is here, he said. Right, so on this whole second wave sort of thing that it's here, experts have been saying the second wave has been coming for maybe over a month now, since the middle of August. If you watch their streams on Sunday, you will know that, because we've been telling, like Voice Britannia, me personally, I've been doing it, our other journalists have been doing it, and some of our freelancers have been doing it as well. We've all been saying that this is coming. It was obvious that it was coming. If you looked at the stats and you look what's happening, it was coming. So he talked about the antibodies and how only 8% of people have actually got the antibodies, which is the reason that Boris Johnson says that, right? That is because this antibody study proves that herd immunity cannot happen, and that there's no way that by letting the virus spread through society that people will develop the immunity to it. There was a study in Spain which we reported on, I think it was in July, and there was another one about a month later in Switzerland that looked at the same, I can't even say the word, it looked at basically the spread of the virus and how many people in society has been left with the antibodies for the virus in areas where there was a lot of spread of the virus. And in both studies, they found that about between 5 and 10% of people are left with antibodies. No one else has them. And even then, the antibodies don't live that long. They're not like really persistent like other antibodies that would like the ones we would develop for stuff like TB or polio, how the antibodies will stay with you for life. With the COVID antibodies, they just don't seem to be strong. I'm not a biologist, I don't know that. I just know that they don't last long, and there's a very low % chance of people actually having them. So it was interesting that he mentioned that. But I mean, they mentioned that because it's evidence to them that herd immunity doesn't work. And that was the initial plan. That's the plan that gave us the first wave we've seen. So it was interesting that they mentioned that. And I think that's just to try and tell people that, like, oh, look, we're not going for herd immunity. It's impossible. Which people told them that. Like, they were told time and time again herd immunity was a bad idea. But they ignored it and kept doing it. Not only did they ignore it and keep doing it, but they kept lying about it. They kept telling people in the media, oh, we're not doing herd immunity. But then someone else, like Valence, would be on radio saying, oh yeah, talking about herd immunity. We knew it was happening. And they lied. So they also talked about how the COVID alert level, do you remember the COVID Nando scale? You've probably forgot about that because there's been so many different random things that this government have taken in and cancelled over the last 6 months that I wouldn't blame anyone for not knowing that happened. But yeah, the COVID alert level is now up at 4. We have went from 3 to 4. Now, again, if you look at the breakdown of how the COVID alert level works and what 4 represents and when you should jump to 3 to 4, this should have happened in August. Again, this should have happened at not even like August. I'm not talking the end of August. This should have probably happened at the start of August when we were getting back to around 1,000 cases per day. This was all there. So Boris said, this is the moment we must act to protect the NHS and shelter the economy. Again, much like the first wave, they don't care about people getting infected. Government don't care about you, me, and our families being infected with COVID-19. They care about people in hospital with COVID-19, because the more people in hospital with COVID-19 means the less beds they are. Less beds they are means capacity fills sooner. If capacity fills, that means there's people dying on the streets. Now, thankfully, we've got army medics and all that stuff ready. The Nightingale hospitals are being set back up, which is a good thing to hear. But this is where we're at. What we're seeing now is a stick and plaster. I've been saying this term a lot lately. This is a stick and plaster, right? This is a stick and plaster on Britain's COVID problems. Now, stick and plasters are a short-term fix to a scuff or a graze, right? You only use stick and plasters for a few days, then it's healed and it's gone away. Think of COVID-19 as an inch-wide gash down my arm. And what government are trying to do is they're trying to fix this gash with stick and plasters. Every one of these stick and plasters, that'll maybe last a few days, but then it falls off and the problem is still there. And that is the problem that we face as a society. This is what government don't seem to see. It's frustrating, you know. We heard the latest buzzword. Now, Gove said this morning, and I about fell out my seat. A stitch in the time saves 9. Now, for anyone that's been following COVID-19 closely and following the government's response to COVID-19 closely, you will know that a stitch in time is something that they have not tried to do in the slightest and save time. They have not saved time. If government were saving time, sorry to do a bit of Boris desk thumping, but if government were trying to save time, let's look at the first wave. They would have stopped people coming into the UK in February. They would have had people being tested at airports for COVID-19 in February. They would have had people in airports with the temperature gun things in February. They would have not let the virus into Britain as much as they did. But rather than that, they let people in for months still. They didn't even close the borders until after the lockdown had started. So for anyone in government to say, a stitch in time saved 9, sorry, that's total nonsense. They wouldn't know what a stitch in time was if they time travelled. That's it. This is not a return to lockdown, Boris said. This is not a return to lockdown. And ain't that the truth? Because the restrictions that I've taken are a joke. Like, the restrictions that are being taken in don't change society we're in at the moment. Like, most of the people in the UK are already in some sort of local lockdown, and the fact with the local lockdowns is we know they don't work, because if local lockdowns worked, there wouldn't be this massive increase of cases we're seeing now. The massive increase we're seeing now is due directly to local lockdowns working. Local lockdowns were used to try and get a hold of the infections before they could spread and into other towns and other regions of the area and get into a bad problem. Local lockdowns were supposed to keep daily infections down. They were supposed to keep R down. What's happened though? We could break down, I mean, from the Aberdeen local lockdown to Leicester to Bolton, if we look at it across the board from when the first one started to now, I think we'll find that the R numbers have increased, and the more local lockdowns that have came out, the higher the R number has actually got. So I mean, I don't have any facts on screen at the moment, but I know that what I'm saying is true because this is data that I read every single day. It's like the R number is climbing week on week on week on week. It has been climbing with, it's kind of ironic in a way, but the more local lockdowns we've had dished out, the higher the R number has went nationally. It's ironic, but it's a fact. They just don't understand it. Now, why is this happening? The reason the local lockdowns aren't working is because places like schools are still open. Shops, like supermarkets don't have restrictions anymore. The only restrictions supermarkets have now is you've got to wear a mask and wash your hands when you're going in. People are still people are still getting really close to each other, and you've got to remember that, like, we've all got most of us have got our faces covered now, but none of us have surgical masks. There's like 1% of people going about with surgical masks on in society. They're the only people that are truly protected. The rest of us, there's still a small chance that we can catch COVID through our face masks. This is why it's spreading. But yeah, the government's, like, Boris Johnson finished his speech there, and Keir Starmer mirrored this as well, which blows me away, that schools must stay open. That schools have got to stay open. Colleges have got to stay open. Now, colleges and universities staying open, that is a crazy one for me because, as he said there, cases are spreading fastest in the 20 to 29 age group. If that's the case, why are you not closing schools and universities? Schools and universities, colleges and universities are majority people that are age 16 and upwards. Therefore, the majority of people at universities are the people that are most likely to be catching COVID at the moment. But we're leaving them open. But the universities do not get closed. The schools stay open. Again, when we talk about our number raising whilst things happen, let's look at schools going back. Since the schools have went back, not only has R went up, everything has went up. You can clearly see, like, if you look at the stats and everything, you can see very clearly how the first lockdown worked. When kids stopped going to school, when people stopped interacting in large amounts, like they do at schools or shops and everything, it went like that, down. Cases dropped right off. They went nearly into non-existent to the point that we all thought we were out of it, that COVID was over, right? Schools and everyone went back, colleges went back, universities went back, workplaces went back, and cases went through the roof. It's not rocket science. And it's bizarre. It's not even bizarre. It's criminal. It's like politically, criminally negligent that these idiots have got such a need to keep schools open when it's clear that the virus is spreading through schools, through children. Now, yesterday, Witty and Valence showed a great chart. It showed you the demographics of who was catching it. And it showed you very clearly that people between 0 and 10 and people between, like, basically kids are catching it. There's been a huge increase in kids at school age catching COVID, teenagers catching COVID, and of course 20 to 29s who have catching it more than everyone. But we leave schools closed. But we leave schools open. But we leave universities open. And this is why these restrictions aren't going to work, because they're short, like they're a stick and plaster. Whilst, yeah, while that bit's being held together, there's blood pissing out everywhere else. So let's have a look at this new restrictions, because we've not even got to them yet. Office workers are being told, if you can, work from home. Everyone else, suck it up, face the COVID reality, wear a mask. That's it. If you can work from home, work from home. Even though Rishi Sunak was guilt-tripping people about working from home, even though the Prime Minister was telling people to get back to work, now, work from home. Which is great for me, but obviously there's millions of people that can't do this. All pubs, bars, restaurants will now be table only, which blew my mind because I thought that was the situation anyway. And there's going to be a curfew of 10 p.m. on all these sorts of establishments. Now, that's great. A curfew, I mean, you could say that a curfew is going to be good. It stops people being in the building all the time. But again, it's just freaking short-sighted. It seems to take into the view that COVID-19 will only affect people between 8 o'clock in the morning and 10 o'clock at night. Which is cuckoo. A virus doesn't know what a watch is. Viruses can't tell time. They don't know light and dark. I don't even know if they're photosensitive. I don't even know if they can identify light from dark. How the hell are they going to know that, oh, it's 10 o'clock? It's time to start infecting people. Haha. No, that's just silly. That's ridiculous. So that's what's happening now. That's a bit short-sighted. I mean, again, that whole thing, it just blames the public. But what gets me is, like, yesterday I found out the actual logic. Because I was wondering, like many people, like, why are they telling people that there's got to be these curfews? What's the relevance of the 10 o'clock at night number? Like, why 10 o'clock at night? What's the relevance? Now, the actual government thinking behind this is that after 10 o'clock at night, people get more drunk. And then people get more drunk, they forget to socially distance. And that is the problem, everyone. Not that people are getting together in pubs. That after 10 o'clock, people are too drunk. Which again blows my mind, because it seems to think that everyone in England is some sort of responsible non-binge drinker, which we know is nonsense. It seems to ignore that people can get drunk before 10 o'clock at night. Like, it doesn't make sense. So people are, like, and on top of this, what if people start changing their drinking habits? People are like, oh, well, we can't drink till 10. That's a bit annoying. How about, let's go out at 12 in the afternoon, we'll get steaming drunk, and then we'll have an after party from 4 in the afternoon till 10. Win-win. We'll take a dead grouse with us. 30 of us can get together. Like, it doesn't make sense. It's well-meaning, but it's well-meaning nonsense. So let's have a look. Next up, face coverings are going to be legislated. You have to wear them. All staff, and this again blew my mind. All staff in retail and taxis now have to wear face masks, which I cannot believe any staff that would work in a shop was not wearing a face mask at the moment. Like, blows my mind. And I've got a quick message for anyone in society at the moment that I can't wear a mask. I've got a health condition, blah, blah, blah. Whatever the hell, I don't care what the health condition is. I don't care if it's quadrophenia, claustrophobia, which I've got every so often. I can relate to that, or whatever else. But if you cannot wear a mask when you're around people, then you should probably be in your house. You shouldn't be around people. End of discussion. Ugh. Yeah, there's going to be more legal obligations to adhere to. That's basically fines, curfews and stuff. The government are going to look to bring more legal back in. That means that we can get fined for stuff. If you don't wear a mask, there'll be £200 fine. Or if you're not wearing a mask in the right place, you can get fined £200 for the first time. Who knows what the repeat offenders will be charged. And that's amongst other things. Obviously, you've got your 10 grand first fee if you break lockdown. If you break self-isolation, you can be fined a whole lot. The rule of 6 is to be downgraded somehow. I don't know how he's going to do that. I mean, surely it should maybe be a rule of 3 if that's the case. There's only going to be 15 people allowed to attend weddings, 30 people to attend funerals, because I don't know why. Because dead people can, if you've got a corpse in the room, it can fight off COVID. I've got no idea why that is. That's a bit silly. Oh yeah, and lastly, this is the last one that really got me. This is a classic bit of Tory nonsense. The rule of 6 is going to be extended to team sports, outdoor team sports. That's all he said on that. There was no clarification on what that actually means. Later in the afternoon, there'll be a press release with all this out, and we will publish this on voicebritannia.co.uk. So if you want to know, don't worry, we'll make sure that you find out, and we've got some clarity to this. But yeah, the rule of 6 is going to extend to team sports. I don't know what that means. Does this mean we're going to have to, football will have to become 6-a-side? Does it mean that we'll have, no, actually it would have to be 3-a-side, because if it's a rule of 6, that means you can only have three people at a team, a goalie, a defender and a striker. Crikey, this is going to make football quite worrying. So anyway, my battery is fast running out. Keir Starmer tried to say something, but at the end of the day, all Keir Starmer did was say that he was going to agree with everything that Boris Johnson said. So that was it. As I said, keep an eye on voicebritannia.co.uk, and we will update the website when the government release the full list of the new regulations, and follow us on Twitter at voicebritannia for updates as the day goes on what's going to be happening on Scotland and on what Boris Johnson says in his speech this evening. Thank you very much for tuning in. Remember and share the stream out, because we can only spread if you help us spread.